يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن.
Well, looking at the health care service over the years or over the decades, you will see, or one will see it, or one can see it in two ways. There has been phenomenal increase in the number of training institutions, in the number of various health professionals, in the number of specialization and sub-specialization and so on. But unfortunately, what in my view has been missing or declining is the spirit, is the human touch. You know, the training, one thing I also recall even in our school days was a lot of the DRF I said that started in 1988. Actually, there have been earlier efforts or attempts to commence charging money in health facilities. One of the pioneer teachers of ABU Teaching Hospital, Professor Lowry, had prevailed, you know, to make government not to introduce payment of fees. And what he used to do was, as soon as he hears okay.
From beginning.
Okay, to fine.
Speciality.
Okay.
Speciality.
Okay. Well, comparing the progress, if one will call it that, of the health service in terms of time over the decade, over the years, one will look at it in two ways. One is the phenomenal increase in the number of training institutions and the production of healthcare professionals of all fields. Related to that, subspecialization in the various fields and departments. For instance, if you look at the teaching hospitals in the north, for a while it was ABU Teaching Hospital, then followed quickly by places like Jos, Sokoto, Kano, Maiduguri, you know, and then others. If you look at nursing schools or colleges, apart from Plateau State that had a number from quite a while, apart from the government-owned in the teaching hospital and Plateau Hospital, they also had missionary schools in Vom in particular, but there was also Ola in Akwanga. Of course, subsequently, there are even private institutions. There are now many. And for Bauchi State, it used to be the pioneer school in Bauchi. Attempts were made to decentralize them, but they were not successful because of issue of standards and meeting requirements of the Nursing and Midwifery Council. In Gombe itself here, we had the school, started with a few number. We had hiccups, you know, but we were able to make up the shortfalls, and happily the number has been increased with the pending issue of the second college in Duku, and also efforts to make private sector participation. So in terms of institutions, the number and products have increased. The big challenge will be the quality of the products, unfortunately. And this one, I'm saying it without reservation, whether it's the medical colleges, whether it's the school or colleges of nursing, health technology, whatever. And in my view, I used to wonder, is it from the training institution that they don't inculcate the humanity, if I will call it? Another thing that you will say in terms of earning also, remuneration, maybe because I was, like I said, in the Ministry of Education for 5 years, I became a convert, out of the health sector to education. And I used to wonder why education is in the state it is. And I used to say, I now realize, although the problem of health, the answer of health problem is not in the health sector, it is in education. And I realize it has to do with literacy or illiteracy. Whatever you do, if the populace is not literate, even your health education may not be successful, apart from variety of actions that education will make you to keep and stay healthy. The lot of the teacher, and by the teacher I'm talking of the primary school teacher, the secondary school teacher, because of course by far they are the largest number in the industry. So long as they remain where they are, not recognized by anybody, by government, by parents who they teach their children, and by society. This is why if you are looking for admission, they say, until you don't get the health sector courses before you go for education, which is wrong. No, but it is wrong because they are not recognized both in societal terms and as well as in remuneration. When you complain that they don't perform, you ignore the fact that you don't pay them a fraction of what they are supposed to be paid. Well, I hope government, whether federal, state, local, whatever, and society will look at this issue. But coming to back to health and health workers, unfortunately, due to the pressure of the sector, government has succumbed to isolate their salary and enhance it. And so that makes everybody wanting to go there. Unfortunately, it will be that many of people going for that training are going for the money. And herein lies the issues you face in the everyday discharge of duty of the health worker. Is a non-secret that many people believe the way they are received in the health facility institutions leave a lot to be desired. So, one is the factor I've mentioned, because people have been driven there by money. So they are not genuinely interested in healthcare, but they are there because of money, and you cannot change the nature of person. Somebody who is not really empathic and so on, just because he happens to acquire a degree in medicine or nursing or pharmacy or whatever, will not necessarily change him. So this is one. The other side of it, society itself. And this I attribute partly to introduction of DRF. In those days, even the recognition, the so-called status, in society, when they say you are a doctor, you are a pharmacist, you are a nurse, you are this, it gave you some standard. So not money, not anything, but yes, you are somebody recognized in society. But unfortunately, because of introduction of DRF in public service, public sector, the thinking about health workers is that money you pay is for them. They don't know that it is not for them. It is for the institution. In case of government sector, it is for revolving. It is supposed to revolve. If it doesn't revolve, it means critical items will be missing. They will not be able to buy that syringe to give the hydrocortisone or adrenaline you require at 1 a.m. Which even if you are to go and buy, there is nowhere to buy. Or to refill your oxygen cylinder. You need money to refill it, unfortunately. So for society, there is need to understand that where money is involved, that they say health is wealth. Whatever care you will do, if you are to pay the person, probably you will not pay it. You will not appreciate it until you are faced with acute emergency. For instance, and this is an area problem with the sphincter. The sphincter is a gift from the Almighty that we don't appreciate until we miss. An example of the sphincter is the bladder, where under normal circumstances you decide, you may be feeling the urge to urinate, you will say, Kai, until later. Because your sphincter is working, you will hold it. But some will not have the opportunity to hold it. Once it is full, it comes out. And you can imagine to be in urinary mess at all times. The other one is even maybe worse, inability to pass urine. The bladder is full, you can't pass it. At that time, if you ask the person to pay any amount for you to relieve him, he will say he will pay. Even if after relieving him, he said, pass, I was not in his senses, he agreed to pay. So what I'm saying here is if you have the means, spending money for your health is a worthwhile thing. And this is why you find that people even go abroad. If you can afford, the way things are, unfortunately, is that the sophistication we have been undergoing by now, we are supposed to be able to manage the bulk of cases that we now have to go outside. And partly it may have to do with maybe poor planning, but even in my view, even government attention. I can't believe that you can stay for this long in Gombe, a state capital, with no MRI, no CT scan for years. It's unbelievable. So that we now have to refer patients from Gombe, whether from the teaching hospital, from the private sector, from anywhere, you have to refer.
يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن